Surely many of you have heard stories about people who lived a healthy lifestyle, ate right, did not smoke, exercised, and yet suddenly suffered a heart attack or stroke. You must agree, in such moments it feels like health is a lottery. But in fact, it is not quite so. Modern science already knows a lot about the causes of cardiovascular catastrophes, and one of these causes is a substance called lipoprotein A. This is Dr. Helena with you. And today I will explain what it is, why it is important, and how you can find out if you are at risk without even knowing it. So what is lipoprotein A and why can it harm us? Now imagine. In our body, various substances are constantly circulating, including fats and cholesterol. All of this has to move somehow through the blood. And lipoprotein A is like a carrier. It transports cholesterol, and it does it very quickly and efficiently. At first glance, great. It works as it should. But here's the problem. When microdamages appear in our blood vessels, for example, due to high blood pressure, diabetes, or smoking, lipoprotein A is the one that begins to stick to these places. And along with itself, it transports cholesterol and fats there. As a result, a fatty spot forms, which over time turns into an atherosclerotic plaque. But that's not all. Lipoprotein A has a component, a special protein that prevents our body from cleaning the vessels. It literally blocks the enzymes that should have dissolved these plaques. That means not only does it deposit cholesterol, but it also prevents removing it. And now attention, the most dangerous part. Such plaques become unstable. They are soft, loose, and can rupture at any moment. And if this happens, a blood clot forms. Blood flow stops and a heart attack or stroke. Sometimes suddenly. Sometimes in a person who has been eating salads and running marathons for 10 years. Can this be checked in advance? Of course. Here's the good news. The level of lipoprotein A can be simply found out with a blood test. It is a standard test, available in almost any laboratory. And what is especially convenient, it is enough to do it once in a lifetime. Why? Because the level of this lipoprotein in the blood is almost entirely determined by genes. That is, it does not change depending on whether we ate pizza or did morning exercise. It is 80–90% determined genetically. That's why it's high in some people and normal in others. And if it is high from birth, then a person is in the risk group, even if they look super healthy. So what values are considered normal? The level is usually measured in 2 units, milligrams per deciliter and nanomoles per liter. Here's how the results are interpreted. Up to 30 milligrams per deciliter, about 75 nanomoles per liter, normal. 30–50 milligrams per deciliter, moderate increase should be discussed with a doctor. 50 and above, 125 nanomoles per liter, high risk of cardiovascular events. 100 and above milligrams per deciliter, 250 nanomoles per liter, indication for specialized treatment. And yes, such numbers are not rare. In Europe alone, more than 140 million people have elevated lipoprotein A. That is about 1 in 5. And most don't even suspect it. In recent years, lipoprotein A has become the focus of intense scientific attention. For example, one of the large European studies showed that in people with lipoprotein A levels above 50 milligrams per deciliter, the risk of ischemic stroke is 20% higher, and the risk of heart attack is almost 2.5 times higher compared to people with normal levels. Many are surprised, but high lipoprotein A is associated not only with heart attacks and strokes, but also with damage to the aortic valve. It can calcify faster than usual. This leads to aortic stenosis, which often requires surgery. Although, as I already said, the test is usually done once, there are exceptions. For example, in women after menopause, the level of lipoprotein A can increase by 20–30%. It can also rise in conditions such as hypothyroidism, chronic kidney disease, nephrotic syndrome, liver disease. In addition, temporary elevation is observed during pregnancy. That is why, if you took the test before pregnancy or before menopause, and especially if your family has cases of early heart attack or stroke, it is reasonable to repeat the test. So can lipoprotein A be reduced? In short, yes, but not so easily. The usual drugs that lower cholesterol, such as statins, do not affect lipoprotein A. It is stubborn. But there are some options. If the level of lipoprotein A is very high, for example more than 100 milligrams per deciliter, and there is confirmed vascular damage, doctors prescribe apheresis. This is a procedure in which blood is passed through a device and excess lipoprotein A is removed. The procedure takes several hours and is done regularly, once every few weeks. Studies show that with regular apheresis, the risk of heart attack decreases by 80 to 90%. That is, it really works. Of course, it is also necessary to maintain normal body weight, blood sugar, and lipid profile, and to lead an active lifestyle, to avoid worsening the situation. And what about nutrition? Can food help? An interesting point. It sometimes seems logical to cut fats, especially saturated ones, to lower lipoprotein A. But here's the paradox. With strong reduction of saturated fats, the level of lipoprotein A may increase. Scientists still do not fully understand why. That's why, for example, the keto diet, which some try to use to lower lipoprotein A, gives mixed results. It simultaneously raised bad cholesterol. It is not recommended to use the keto diet as a universal solution. Therefore, it should only be applied with individual indications and after a full blood analysis. Even though nutrition does not have a strong effect on lipoprotein A, some substances and foods may help moderately. Here are some foods and supplements that showed a modest effect in studies. Nuts, especially almonds and pecans. Omega-3. Flaxseed oil, which influences the activity of a gene related to lipoprotein A production. L-carnitine. At a dose of 2-4 grams per day, it may lower lipoprotein A by 9 milligrams per deciliter. Coenzyme Q10, 100 to 150 milligrams per day, which has a similar effect. Ginkgo biloba extract. In one study, the reduction was up to 23% with a dose of 240 milligrams per day. But it is important to understand. If lipoprotein A is very high due to genetics, then nuts alone will not fix the situation. Sometimes more serious measures are needed, apheresis or medications that are being developed. Currently, active research is underway on drugs that specifically lower lipoprotein A. For example, pelacarsen, an RNA-based drug, reduces the level by 80–90%. Lepodisiran. The study showed a 94% reduction within 6 months after a single injection and maintained effect for a year. The drug was well tolerated, with no serious side effects detected. Olpasiran, a similar drug, now in the final stage of clinical trials. It is expected that within the next 1–2 years they will appear in clinical practice. So lipoprotein A is an underestimated but very important marker. It can explain why blood vessels suffer even in seemingly healthy people. Checking it is simple, and knowing about it is truly useful. If the level is normal, you can be calm. If elevated, it is not a sentence but a reason to pay closer attention to your health. All science in simple words. May your knowledge be beneficial and your health be reliable.